If you're a personal trainer or weightlifter who's been dealing with chronic shoulder pain for 3 or more months now, or you've been experiencing symptoms on and off whenever you try and add back in some of your favorite lifts or workouts in the gym, and you're wanting to really get at the root cause of this issue so that you can get it resolved for good, this video is going to be very powerful and is going to help change your perception of traditional medical conditions and traditional structural based issues that we typically think of whenever we've developed chronic pain. Maybe we've been to see a traditional physician or medical doctor, and we may or may not have been diagnosed with one of these conditions over here on the right side. Is that a death sentence? Does that mean that you will always have to scale back your workouts, be really careful about your exercise selection permanently? Or is this issue more of a continuum? Is it possible to flow from one side of this chart back over to the other by doing improper things? Or is it conversely possible to start flowing from the right side of the chart back over towards the left side of the chart, doing more of the things that you would like to be able to do, feeling more confident in your body and your capabilities once again? So when we typically think of pain, which is what gets most of us to take action, is that we start noticing that we are experiencing shoulder pain, and probably not just on one occasion, but happening on a recurring basis, where we start to notice that we have diminishing performance. We're not moving the way that we want to in the gym. We're not pushing the weight that we want to be able to. And maybe this led us to go to a physician and get some type of imaging and receive a diagnosis like one of these items down here below. Now, in some of these cases, something like a significantly torn rotator cuff or labral tear, depending on the extent of the structural damage, may end up requiring a surgery. However, fortunately, that's in the vast minority of cases. In the vast majority of cases, in 85, 90+% of cases, when they do research studies, these sorts of things can be improved significantly with conservative treatment, doing the right things that do not require surgery or more invasive options. And the interesting thing is that when they look at MRI studies of people both with pain, shoulder pain, as well as without shoulder pain, that once people hit a certain age, once you get into your 30s, and then especially once you get past your 40s, 50s, and 60s, the percentage of people that have structural changes, such as changes in the structure of the tendon or tendinopathy, small rotator cuff or labral tears, or some degree of arthritis, starts to increase rapidly. Now, with that being said, a good percentage of these people, and when they did this study, a lot of these people reported no shoulder pain at all, despite having these structural findings. So hopefully I'm opening up your eyes to the possibility that these structural changes are not always correspond with pain and decreased performance, but that they can be present and you can still live a happy, healthy, and fulfilled life where you can perform at a high level. Now, what is the difference between the people that are experiencing pain and the people that are not experiencing pain with some of these structural changes? Well, a lot of it comes down to how these things over here on the left side of our continuum, things like how are they structuring their programming in the gym, what sort of exercises are they selecting, and how many exercises are they doing for muscles on the front side of their body versus the back side of their body. What are they doing for the stabilizing smaller muscle groups versus the bigger muscle groups? And then how many days a week are they exercising, and what does the recovery look like in between their workouts? Things like this can really help us to paint a clearer picture for why some of these people on the right side of the chart are experiencing pain and why others aren't. As part of our thorough assessment with the Triple R program, we will help to identify some of these risk factors over here on the left side that are causing you to be in the category over here on the right side that is experiencing pain and decreasing performance. And so that you can start with the right time and reinforcement, pushing yourself back over towards the left side of the continuum here, where everything's healthy, happy, and you are working out the way you would like to, pain free.